aspect of the population, what effect was the closure of the A&E at Hammersmith Hospital and the Central Middlesex Hospital had?
Again, I don't have concrete evidence
from your knowledge and understanding as far as
of that. However, we have had discussions with Health Watch, and perhaps given some of the earlier comments about Ealing Health Watch, I have to say that our experience in Hammersmith and Fulham has been somewhat different, that they have been champions of local patients to a very large extent. But Health Watch themselves have said that attendance at Hammersmith Urgent Care Centre has fallen dramatically. Indeed, it was suggested that should I need some urgent care, that would be a really good place to actually go to rather than waiting for a long time at Charing Cross or at Chelsea and Westminster. So I think one of the things that's actually happened is that people don't know what to do, and Health Watch again have reported that their evidence is that people, it's not that people are going somewhere else, but that in many cases people are just not going when they probably do need medical help.
I don't know if you're able to help with this, but do you have an understanding of where they're getting that information from? What's the evidence base for that?
I think they did some research on it.
Now,
I think you have to ask them, and I gather you are meeting with them later on.
Now, moving on from that, if Charing Cross Hospital has goes down the same route, and Ealing goes down the same route, and the A&Es are either shut or changed in their format, if we can put it like that, again, from your understanding of the situation, what do you say the impact will be on, first of all, let's just take it, the south richer population and then the north poorer population?
I have recently had reason to go to the urgent care centre at Chelsea and Westminster Hospital, and the waiting times there were not good, and I was told it was a good time of day to be there. What I think will happen is that other hospitals will be under huge, huge pressure. Did that answer it properly? Sorry.
Could I add just one factor to that? Because we do campaign in a variety of parts of the borough, and what we do know is talking to people, for example, people who are frail, people who are quite old, mothers with 1, 2 or 3 children, who find it very hard to travel far because of their condition or because of who they're in charge of. They say, if we had to get up to St Mary's or to Chelsea, Westminster, we just could not manage it. And they add significantly that were they to go and seek help and then have to travel home afterwards, often people with low income, they simply could not afford taxi fares. So what we draw from that is that people would only go to travel great distance if they were certain they really were in a very bad condition. But people tell us they're not trained medical staff, so they don't know how to self-analyse. What happens thereafter, I would like the local CQC to explain to us. CCG.
Can I just ask you a little bit about the waiting time? Now, you've attached to your submission, and I think it's at page 1197 it starts, you've attached some graphs, and perhaps without going into huge detail about it, if you could just take us through what those graphs mean.
Someone else has done the graphs.
They've done them very beautifully. I'm just wondering what, in broad terms, that actually tells us about what's going on.
I think what's key, I think what's key in terms of the graphs is that at a certain point, not everyone can see it, but there's a vertical orange line. That's the point at which the 2 A&Es closed. And what you see are the meeting of the A&E waiting times being failed, falling below the 95% requirement.
This is the 4-hour.
Quite dramatically, yes. I think there's other interesting information in these graphs, because much has been made in the press about the fact that this has been an England-wide phenomenon. The actual graphs show that this isn't the case. To the extent that there was a national problem, that is certainly reflected in this area, but if you disaggregate the information, you actually find that North West London Healthcare NHS Trust has failed dramatically, that Imperial Healthcare Trust has failed pretty badly, and if you take those figures out, that London was doing better than England as a whole. So that there's been a significant local effect in terms of the closures of those two A&Es on hospitals actually meeting the required 4-hour waiting time requirements.
Are you able to help with whether or not that's something which is changing now that we are coming out of the winter period into spring, or whether that is a continuing situation?
The information that I have is that it's a continuing situation, but with possibly some amelioration.
Now, I just want to move on and ask you a little bit about the standards at St Mary's and the Chelsea and Westminster hospitals, because we have CQC assessments of those. Do you have any comment that you wish to make about those and about the use of the services there?
I think one of the things we wouldn't want to do is to sort of put one hospital against another hospital, but at the same time, we do have to say that it is quite astonishing that the hospital that has become the prime location for most of our care in the future is to be St Mary's, which has failed quite dramatically in much of the CQC inspection, whose A&E, not just for the cleanliness issues, but on a range of other issues, was deemed to be inadequate, that it is to be the preferred A&E rather than Charing Cross. At the moment, Chelsea and Westminster has been doing reasonably well in terms of meeting demands, but what happens, of course, when you lose the other A&Es, who knows?
Can I ask you please now to turn on to thinking about the out-of-hospital services?
Yes.
There's a bundle in front of you marked Volume 2, and I'd like to turn please to page 586, and that should be a letter from the Hammersmith and Fulham Clinical Commission Group. I think it's at the, sorry, don't go just 2 seconds.